AABIP Video Educational Series, Tunneled Indwelling Pleural Catheter, using a Pleural Catheter Access Kit. In this video, we will review the individual steps of attaching a tunnel indwelling pleural catheter to a pleural catheter access adapter. The pleural catheter access adapter can be used to instill fibrinolytics into the pleural space, sample the pleural space, and to troubleshoot the pleural catheter. We will be using the Pleural catheter for this educational video, but please note that the individual steps of using a pleural catheter access kit can be applied to other brands as well. A blue clamp, alcohol pads, valve cap, 10cc syringe, and pleural access adapter are included in the pleural catheter access kit. First, the valve cap is removed from the tip of the pleural catheter with a twisting motion, and then cleaned with the alcohol pad. Next, a 10cc Lure Lock syringe is attached to the pleural catheter access adapter. This together is then inserted into the access tip of the pleural catheter and is secured with a twisting motion. A click should be heard. Once attached, pleural fluid can be withdrawn into the syringe, or fibrinolytics can be instilled into the pleural space via the pleural catheter. To remove the syringe, simply twist and pull apart at the Lure Lock junction. The pleural catheter access adapter along with the syringe can be removed from the access tip of the pleural catheter by unlocking it with the twisting motion and then pulling it apart. When complete, the access tip of the pleural catheter is cleaned with an alcohol pad and the valve cap is attached and secured with a twisting motion.